Very good. So what we see, the prostate is a what? The prostate is a what? A pyramid. Okay, so what kind of pyramid? The prostate is described as an inverted, truncated pyramid. Truncated, why is it truncated, Janelle? Yeah, what do you mean by truncated? What is truncated? What is very good, Adrian? The sharp apex of the pyramid. So the sharp apex of the pyramid is just lopped off. So the prostate is a what? An inverted pyramid. And the base is facing how? Superiorly. The base is facing superiorly. The apex is facing inferiorly. The apex of the prostate, we're not doing prostate now, we're doing urinary bladder, just to point out that the neck of the urinary bladder is in relation to the base. And there's a groove called prostatic-vesical groove. Then I ask the question, the apex of the female urinary bladder, what is that in relation to? The apex of the female urinary bladder, what is that in relation to? Jody? With vagina. No, sir, we can't have, because the apex is going to, the apex can't be there in the vagina. That means the urine would go into the vagina. No. No, uterus, urine doesn't go into uterus.
Sir, is it the
Excellent. Adrian is a man on the ball. He says the superior aspect of the UG diaphragm. 300 marks. Okay? All right?
Okay.
So there, you can see, look at that right in there. Can you focus here, Marissa? Mm-hmm. You see that the pelvic diaphragm is not complete. Mm-hmm. It's split. There is a gap. Mm-hmm. You see that gap? Okay? And that gap, that spacious gap is now filled in by a horizontal diaphragm. That horizontal diaphragm is known as the UG diaphragm. Okay? So there you can see now, from anterior to posterior, there you can see the neck of the female urinary bladder, the neck in relation to the what? Superior fascia of the UG diaphragm. Okay? Alright, so you see the neck. There you see the region of the cervix back here, and there you see rectum becoming what? Anal canal. So that gap is filled up by the urogenital diaphragm. So the neck of the female urinary bladder is related to what? The superior fascia of the UG diaphragm. The neck of the female urinary bladder sits on a horizontal platform. So there's a horizontal platform filling that space, and that space is known as hold is just Trina's hold is here of the pelvis. That horizontal thing is known as the what? The urogenital diaphragm. So the neck of the female urinary bladder is in relation to the what? UG. And then that neck is going to be continuous as the female urethra. Female urethra is how long? About 4 centimeters. And it's going to immediately pass through the UG diaphragm to form a membranous part. Okay? The membranous part of the thing. And then just emerges literally to just enter now into the vestibule of the vagina. So the female urethra is very small and is surrounded by muscle. And their muscle is known as the sphincter urethrae. Right? But the female, the urogenital diaphragm in the female has a bigger muscle known as the sphincter vaginae. The what? Sphincter vaginae. Okay? And then now there's in there also another muscle called the deep transverse perineum. So when we look at the female, we'll see that the female urogenital diaphragm, what goes through there is the vagina. And that vagina is now surrounded by a muscle. And that muscle is known as what? The sphincter vaginae. Alright? And a part of that sphincter vaginae is, where's the female urethra now? In the adventitia of the anterior wall of the vagina. You following me? So the anterior wall of the vagina has a tube going through called the what? female urethra. And some of the muscle now will encircle the urethra. And that's called the sphincter urethrae. All right? But the big muscle in the female urogenital diaphragm is the sphincter vaginae. All right? So we all know, for example, after women have childbirth and all of that, certain things become a little what? Larger. Okay? So a little larger. So then now the women have to do some little exercises to build back what? To build back the tone in the vagina. Okay? So what they do is when they're peeing, they're forever just stopping the pee like that. Okay? So when you contract the sphincter urethrae, at the same time the sphincter vaginae is contracting. So yeah, of course the women have to do that. You haven't reached there, Janelle. That's a long way to go. Right? You have a long way to go. All right? So you have a long way to go now. All right? But you can also contract it like that. But especially when you're passing and you want to stop the urine like that, then at the same time now, because the urogenital diaphragm has the real muscle is there, so that muscle is going to form the sphincter around the vagina that gives the muscle tone to the vagina. Okay? And then we'll surround, some muscle fibers will loop around the urethra. Okay? All right. So the male urinary bladder, there we can see the inferior vesical artery. That inferior vesical artery now is going to form the principal blood supply to the To the prostate. All right? And then now we need to know that the prostate has 3 arterial supplies. What are the 3 arterial supplies to the prostate? Jackson. 3 arterial supplies to the prostate. Principal one are prostatic branches from the inferior vesicle, but also the middle rectal. So the middle rectal artery is a funny artery. Last will tell you really it gives very little supply to the rectum. In fact, it's more of a supply to the prostate. Okay? And then now, last supply to it is an artery known as the apex of the prostate is in relation once again now replaces, so the whole of this in the woman would be, in the female would be the urinary bladder, but intervening between this now is the prostate. So in the male now the apex of the prostate is related to the superior fascia of the UG diaphragm. Remember, the prostate is turned upside down, but the urinary bladder would go right down to the UG diaphragm, but in the male now it's separated by the prostate. All right. I have a meeting at the dean's office, so I'm sorry to end a little early. Oh, third. Very good. And that's what that's leading to. As it lies on the urogenital diaphragm, the artery in the urogenital diaphragm is the internal pudendal artery. All right, okay. But anyway, next time we will continue.
End of story.
End of story. Very